The gift of care. The next module is on providing basic care. Adapting your home is critical for the safety of the person that you love. Sometimes you may need to adapt your home to care well for someone. Some tips include flooring. Carpets are the safest form of flooring for walking, not the throw carpets that are loose, but the ones that are firm. Hardwood can be very slippery, so if you have hardwood, it's best to provide slippers that have a sticky bottom to prevent slipping. Furniture and other things. So small table at bed height next to the person if they are bedridden. And armchairs for the person who's most near to the bed so that they can sit beside the person. It's so much better to sit beside a person rather than stand over them. A footstool can be helpful if the person is sitting up to reduce swelling. A buzzer or a bell of some kind so the person can call for help if they are in one part of the home and you are in another. Good lighting is very helpful to allow them to read and to enjoy television or radio or listening to music. Having a telephone nearby, having a backrest in bed or in the chair so the person's back is comfortable. If they are in bed for any length of time, a sheepskin padding of some sort is very helpful to prevent bed sores. Incontinence pads are helpful for both bed and chairs. A footboard to prevent the person from sliding down in the bed if there isn't one already at the end of the bed. Having a commode or a bedpan close by relieves the person from having to walk far to the bathroom. For mobility, canes or a walker or wheelchair are very helpful, of course, and many of these can be provided free through a local home care program in your town or city. Grab bars, especially in bathrooms and getting in and out of bed, can be very helpful if the person's going to be bedridden or chair dependent for a good long time. Aids for lifting the person if they can't be very helpful in getting in and out of bed or the bathtub. And of course, considering what they should be eating and reaching the types of utensils they may need to help them with that. Preventing falls is critical. So often, especially with elderly people, falls are what predicate a trip to the hospital. Most of the falls occur at home when the person is sick or recovering, or even when they're healthy. Some of the causes of most falls are loose rugs, wet or slippery floors, especially in the bathroom, objects left on the floor, toys or magazines or papers that slip when you step on them, steps on a staircase that don't have either carpeting or some anti-slip material on them, and those same staircases without railings. Railings are really very critical to help someone who has some mobility issues. Prevention of falls can best be facilitated by talking to an occupational or a physiotherapist to come to your home and do an assessment of your home around the rails on a bed, flooring, all the things that can lead to falls. Some of the things they may recommend are to add night lights to prevent movement in the dark, grab bars in the bathroom or bedroom, handrails as we talked about, also rails in hallways if the person has to walk down a long hallway and has mobility issues. Having electrical and phone cords tucked under a carpet or along baseboards and then taped down so that they don't cause someone to trip. And to rearrange furniture so it's the easiest mobility so the person doesn't have to go around tables and chairs in order to get from point A to point B. In preventing illness and infections, there are some fairly basic things that you will have seen other people do that you need to copy. One of those is to wash your hands regularly, especially before and after providing personal care. Little trick that I heard of years ago was to sing happy birthday in your head to know how long you should be washing for, because typically we wash for too short a time. You need to wet your hands first, add soap for a good lather, wash the whole hand vigorously, including the wrists, the back of the hands, between fingers and under fingernails. You rinse thoroughly and dry with your own towel or a paper towel. You can shut off the tap with the used towel rather than get your hands dirty again by using your hands to do that. Use cream and lotion, hand lotion, to prevent dryness or chapping. Another thing to consider is to wear latex or vinyl gloves and a disposable apron if you're likely to be touching body fluids. This just is common sense. If you are helping your loved ones with needles, make sure that disposed needles are put into a separate container like an empty bleach bottle. If you have a cold or flu, it's important that you wear a mask for the time that you do. Obviously, this is not the time for your loved one to be catching either one of those. To help loved ones move, there's some things to consider, especially transferring someone in and out of a chair or a bed or to go on a walk. Get a nurse, the visiting home nurse to your home, the occupational therapist or the physiotherapist to help you learn these skills. There are many Google, YouTube videos that might be helpful, but use them only for general information. Having professional help until you learn how to do them properly and specifically is very important. The reason for that is that all general videos do not consider your loved one's personal strength and stamina. One technique for helping someone from their bed to their chair may work for some, but not for others, who require a different approach depending on their physical abilities and what they're recovering from, because of course different surgeries have stitches in different places, and that will make mobility different than for other patients. Bed care. Helping someone who is restricted to bed for a while requires some specific skills best learned from a professional. For example, bed baths, washing someone's hair when they're laying in bed, helping shower them, skin care, positions in bed to prevent bed sores, and making of an occupied bed can be all pretty tricky things. One of the best places to learn these is in the hospital before your loved one is discharged. Rather than leave the room, which is fairly typical, ask if you can stay and watch how someone gives a bed bath to someone in bed. It is not as logical as it would first appear. For example, when my mother came home and we were taking care of her, we gave her her first bed bath. And we assumed, my father and I, that the way to give a person a bed bath is the same way you give a baby a bed bath, which is to wash them from head to toe and then dry them from head to toe. If you've ever had a bed bath or seen one, you'll know that the person will have goosebumps from being wet from top to bottom before they are dried. The proper way to do it is to keep the person covered and to wash an arm and then dry the arm, wash the other arm and dry that arm, etc. throughout the whole body. So the body is mostly covered throughout the bed bath. Pain and symptom management is critical. There is absolutely no excuse in modern health care for unbearable pain. There is no reason anyone has to have persistent, unbearable pain. You need to get professional help through either home care or through a pain and symptom management specialist, and then learn from them how to provide the pain and symptom management that your loved one needs most. Many people worry about pain but forget that rashes or not being hungry are also symptoms that need to be managed. A draw sheet is one of the most remarkable inventions ever, in my case, and I didn't know what it was until a nurse showed me. Basically, a draw sheet is just a regular sheet folded in half and laid sideways on a bed. In the illustration, you will see two sets of hands. This is a two-person lift or changing the person's position in bed. By lying on the sheet sideways, two people can lift the person and move them up or down in bed or turn them without having to actually touch the person, especially if they have painful bone cancer, as an example. You want to avoid touching them to help them move about in bed. Often people sitting up in bed will need to be repositioned because they will slowly slide down into the bed. A draw sheet can help to turn a person in bed who has difficulty with mobility issues. The main reason for this is to avoid the person in bed having to do the work, whether they can or cannot, and to prevent injury to the people helping them. Another wonderful trick that I learned from a nurse that you too can learn from those caring for your loved ones, either in hospital or through home care, is how to turn a person in bed, the proper techniques to prevent injuring yourself while you're caring for someone. You can learn this from a nurse, from an occupational or physiotherapist, the proper body mechanics to help someone. In this illustration, you'll see that the patient's left arm is under their body, their right arm is across their chest, and their right knee is bent. And when this is done properly, you can actually just turn the person by lightly pulling on their shoulder and their knee towards you. Body mechanics causes the person to turn without you having to exert a lot of pressure or strength on your own part. It's a wonderful trick and one that you can learn quite easily. Incontinence is when someone has difficulty controlling their bladder or their bowels. And again, a nurse, an occupational therapist, or a physiotherapist can help you learn some skills around this. You'll want to learn how to reduce odors, infections, rashes, and particularly bed sores. Get advice about reducing incontinence through medication, possibly through diet change and through exercise. Again, Google and YouTube have videos, but only use these for general information. Again, get the specific help you need in caring for your specific loved one. A few extra tips. Put a plastic sheet under the bottom bed sheet to protect the mattress. Using incontinence pads or a towel on top of the bottom sheet is another way of easily changing the pads, but also keeping odors down and refreshing the bed. Skin must always be dry and clean to prevent bed sores and rashes. Bed sores are very difficult to treat, so your prevention is the key here. Use soapy water and pat dry as needed. And get professional help to teach you and what creams to use, if any, to prevent bed sores. Pajama bottoms are really impractical for someone who's bedridden for a time, so it's much better to use long t-shirts or oversized flannel tops. Socks are a good idea to keep the person dry and warm, and using occasional towels and such in the dryer for a few minutes to warm them up and put on top of the person helps reduce chills after a bed bath, for example, or if you're caring for someone in the wintertime. Adult disposable underwear may be preferred by some people. We sometimes say that it's a lack of dignity if you wear such a thing. It's a silly concept because, of course, dignity isn't defined by whether or not you need a disposable underwear. Dignity is an inherent quality that you can't give someone, but you can take away if you treat them poorly, like a child, or without the respect they deserve. So, summary of this unit on basic care. You may need to adapt your home depending on your loved one's needs, especially around flooring or furniture needs or grab bars. Looking at how we prevent falls by examining the causes of them typically and how to prevent them through various strategies that a nurse or an occupational physiotherapist can help you with. How to prevent illness and infection by washing your hands regularly before and after care, wearing gloves, and wearing a mask if you have a contagious condition like a flu or a cold. We looked at some mobility tips and bed care issues around bed baths, pain and symptom management, the wonderful gift of a draw sheet in moving someone in the bed, and how to turn a person in bed with their knee up. And we looked at ways to reduce the difficulties of incontinence, how to reduce odor, how to refresh a bed, clothing that would be helpful around those things. Our next unit will be looking at navigating healthcare systems from a patient-family perspective.